The West Nile virus can be spread from mosquitoes to birds and to even humans. It is now being studied right here at UTC. Audrey Shirley tells us about the new surveillance study being carried out to determine if it can affect us here in the Tennessee Valley. Audrey?
Sierra, UTC professor Dr. Dawn Ford and her students test both mosquitoes and crows in Hamilton County for West Nile virus, and they found some pretty interesting results.
After noticing the lack of established health surveillance programs for mosquito and bird testing in Hamilton County, Dr. Dawn Ford with UTC's Department of Biology, Geology, and Environmental Sciences wanted to change that. So she and her students launched their own study to give back to the community. Although 90% of vector-borne diseases are caused by ticks, 10% of these diseases, including West Nile, are still caused by mosquito bites and other insects. After finding a method to effectively trap mosquitoes, students were able to test liquid from Culex mosquitoes to see if RNA from the virus was detected.
It's kind of like a COVID test. Like you put drops of the liquid on the little tester and you let it dry, and then you put it in the machine, and within a couple minutes we have a result.
With the small pool of mosquitoes tested, all of them were negative for the virus. But the study did not stop there. An additional test using a similar procedure was made from a dead crow. A throat swab found a positive test result, making this the first crow in the state of Tennessee to be positive with West Nile since 2023.
What that tells us in Hamilton County is that there is West Nile virus in our environment. So if it's in the birds, it's likely in mosquitoes. So it is a potential that it could be transmitted to people.
Crows and blue jays are most susceptible to the disease, and they can get it from an infected mosquito. There have been 15 cases of West Nile detected in Tennessee this year so far, but overall, Dr. Ford says it is rare to contract.
It's something to watch for. You know, if you get a lot of bites and then you start not feeling very well, you might call your healthcare provider just to check things out.
Wearing long sleeves and long pants and using bug spray are the best preventative measures to repel mosquitoes. Only 5% of people who contract West Nile virus show flu-like symptoms, which can lead to hospitalization if it is severe. Now, those who are asymptomatic do not need to worry about additional risks.